When working in an early years setting, including a nursery or childcare provision, the care, safety and wellbeing of the children is your number one priority. As an early years practitioner, you're part of a caring profession responsible for looking after babies and young children from birth to age 5 years old. Respectful caregiving requires considerate and well thought out interactions where the safety of the child is always at the forefront of your mind. Hiya everyone, I'm Zoe from My Progression and this video will discuss respectful caregiving in a nursery setting. In nursery settings, you're consistently building relationships with the young children that you care for. This is through all the different interactions with them throughout the day, however big or small. It's vital that these interactions are positive and respectful to make each child feel supported and valued. As a nursery practitioner, you should engage in nurturing behaviours, including being protective, watchful, and acting with care. All your actions should be carefully considered, ensuring that the rights and the best interests of each child are prioritised. So, how can you build trust with nursery-aged children then? Well, as an early years practitioner, physical caregiving moments such as nappy changing, feeding, and dressing must be a positive experience for the child. These early experiences are vital to building relationships between trusted adult and a young child. Therefore, all physical care should be well planned and follow the setting's safeguarding procedures. In an early years setting, young children should have specific key adults that they build strong relationships with. To build trust, children must experience consistency. This includes having the same key adults and caregivers alongside a structured daily routine and consistent expectations. These adults should take responsibility for carrying out the child's personal care, as well as delivering other areas of the EYFS framework, including opportunities for communication and physical development. In England, the Early Years Foundation stage, known as the EYFS, is a statutory framework that schools and childcare providers must follow for the learning, development and care of children from birth to 5, including safeguarding. For more information on safeguarding, please watch our CPD accredited safeguarding course, detailed in the description below. So what is intimate care then? Well, intimate care is when an activity is carried out to meet the personal needs of a child. This could include providing care that requires direct contact or exposing private body parts. You will also come across the term intimate care when working with children or adults with additional needs. If you're required to carry out intimate care within your job role, this could include changing nappies or underwear, helping a child use the toilet, or supporting someone in the shower or washing someone. Intimate care can also include a wide range of physical care, also known as personal care. This can include feeding, changing clothing, applying or administering medication, and hair care. All organisations must have a policy in place which sets out how they will meet the needs of a child whilst protecting their safety, privacy and dignity. Policies should be read and consistently followed by all staff members and should also be shared with parents and carers. If you work in an earlier setting, it is vital that you understand and follow the intimate care policy and keep up to date with any changes. Now, when providing intimate care, this involves supporting children during moments of heightened vulnerability, which can increase the risk of abuse. To safeguard children, it is essential for settings to implement measures that prevent abuse, uphold children's dignity, and ensure a safe, comfortable environment for all. This includes having clear procedures for reporting concerns about a colleague's conduct. Intimate care also offers valuable opportunities for focused and positive one-to-one interactions with a child. During this time, a child may disclose something concerning, or you may notice signs of potential safeguarding issues, such as changes in behaviour or unexplained bruises or marks. Now, if this happens, you must immediately report your concerns to the designated child protection lead following your setting's safeguarding policy. When working with a child, you must consider their individual care routine. Each child should have an intimate care plan that includes their support needs, routines, things they like and things they don't like. For children that have special educational needs or disabilities, they should have a detailed, up-to-date care plan that sets out what intimate care is needed, where it will be carried out, and who will provide it. If you're finding this video helpful, why not check out our EYFS series, designed specifically for our early years educators, by clicking on the link below. This series was created to support all nursery staff in their understanding of the EYFS, as we really understand how important early childhood experiences are. And if you haven't already, like and subscribe and click on the bell to keep showing your support to my progression. If you want more nursery content from us, write yes in the comment section below. So, what does respectful caregiving actually look like? When promoting a respectful caregiving environment, it is vital that the child is seen as an equal by all of the adults who work alongside them. It's crucial that the adult should be seen as doing everything with the child, not to the child. This is important to create an environment where every child feels valued and heard, and where building trusting relationships is a priority. As an early years practitioner, you can promote a respectful environment in many different ways. For example, be mindful of your body language and tone of voice. Ensure that you consider how your actions can impact a child's emotional state. You may need to adjust your interactions with a child based on their responses and needs. As well as this, you need to give the child your full attention when communicating with them. This includes being patient and giving them time to respond, if they're able to. Also, it's important that you take a slow approach towards giving personal care to ensure it's respectful and following any plans and procedures. This includes communicating with a child by asking permission, explaining your intentions, and offering choices. Whilst you're promoting a respectful environment, you can use this opportunity to teach children about consent. This can be done through asking permission for what you're about to do and explain why you are doing it. For example, is it okay if I help you get changed? Your clothes are wet, so by putting dry ones on, this will make you feel more comfortable. Positive experiences of intimate care show a child the appropriate way that adults should act towards them. Something that I used to do when I was a teacher to teach children about consent was using the NSPCC's Talk Pants resources. These are recommended by the PSHE Association. This approach teaches children about the underwear rule, which covers privacy and consent in an age-appropriate way, without using any of those scary words. They have different versions of the resources which are adapted to different ages of children, including those with SEND. We've attached a link to the NSPCC Talk Pants resources in the description below. Overall, respectful caregiving in early years settings should be the #1 priority to ensure all children feel safe, valued and supported. As a nursery practitioner, you will build trust with young children through consistent, positive interactions, especially during intimate care tasks like nappy changing and feeding. Through these positive interactions and promoting respect, young children learn from an early age about privacy, boundaries and consent. As early years educators, we know how important these early experiences are and how these can really shape a child's life. Therefore, in all nursery settings, clear policies must be in place to protect children's privacy, dignity and safety, with safeguarding procedures followed at all times. As well as this, each child, particularly those with SEND, should have an individual care plan, which must be read by all key adults and be updated regularly. It's our responsibility to ensure that the children in our care have the best start in life through these really positive nursery experiences. I've been Zoe from My Progression. Let's keep your career in motion.